So today we are going to talk about intake output record, how to calculate meticulously in pediatric ICU. Last lecture was how to augment diuresis, and in that lecture it is very important to know about meticulous intake output record. So how we can do in pediatric ICU. Age range is quite big. We are dealing with 1 kg newborn, and pediatric patient can be 70 kg in pediatric ICU as well. Proper documentation is important for intake output record, and it is important both for dehydration, like patient with shock, even maybe because of sepsis or gastroenteritis, or in cases where we need to get negative balance to with diuresis, and especially if we are looking for less chest wall edema and pre-extubation diuresis. And not every patient can have urinary catheter, CVP line or arterial line for monitoring. So we have to do our clinical acumen at the bedside. And the most important thing, bedside presence and sitting with the nurse and calculating intake output record. So how we can do regarding intake records? We need to calculate all drips, including maintenance fluid. We have to keep in mind all infusion, boluses, partial or total parental nutrition fluids. All medication need to be included, blood products, and even if someone is on peritoneal dialysis, we need to know the fluid, whether patient is positive or negative regarding PD. Also, we need to count all flushes. Output record is very important, especially the urine output. Maybe we are doing pamper weight or put a bag, or there is a urinary catheter in place. So it depends on the sickness of the patient. We need to count OG or NG aspirates, drain like chest drains, peritoneal drains, hemofiltration, PD balance, negative or positive. And if someone has neurocritical issue, then maybe with the intraventricular drains, having a ICP monitor. Losses like especially burn, lot of insensible losses. ET suction is very important. Someone is febrile, there is a lot of insensible losses. Sampling also we need to count, and stool output is the most important thing, including ileostomy outputs, because a lot of times you can have patient in a ward or HDU with gastroenteritis and going into the shock because of not proper documentation of stool output. So obviously it is paramount, especially when you are documenting output records, to check about the stool output proper. So what are the take home messages? The most important mistakes: people are not calculating medication, flushes, boluses, blood products. Regarding output, stool output is very important, especially if you are doing pamper weight, it can misguide you. And be aware of bleeding in pediatric cardiac surgery patient. They can bleed very quickly and go into the shock.